And we keep hearing something called an ectopic pregnancy. What exactly is that, ma'am, and what is the result of an ectopic pregnancy?
See, pregnancies are supposed to be coming inside the uterus.
Right.
And now inside the uterus means center of the uterus. If pregnancy is outside of the uterus, in the tubes, on the ovary, somewhere else in the abdomen, rarely, some corner of the uterus or near the cervix, which is absolutely lower part of the uterus, these are technically places where the pregnancy cannot grow and thrive, because pregnancy needs thick uterine muscle for blood supply, growth, development, stretching and all that. When you are not able to get that environment, it just opens up. So ectopic pregnancies are not only abnormal locations of pregnancy, it can cause dire consequences and it can cause permanent scarring. So sometimes when the ectopic pregnancy is in the tube, it completely damages the tube. That tube is of no use. And sometimes it ruptures and we have to, the woman lands into a pool of blood, sometimes 2-3 liters, more than 50% of the blood just gushing out and collecting in the abdomen. It is such a horrifying thing, and people lack understanding about the problem. They will say, why don't you pick it up and put it inside the uterus, which is not possible. Pregnancy is something tightly stuck, and they would always say that give some medicine for it to melt. But there are medications to melt, but eventually you land into another ectopic in that place because there's scarring. So it's all diversified. So it's all in the outlook. You ask for medical treatment, I will give you medical treatment. But what next? What's your future about it?
Is there anything to prevent this or avoid it or reduce the chances?
Yes, of course. Sperm quality, if it is good, tubes are good, usually ectopic pregnancies don't happen.
Okay.
Sometimes there are tubal blockages, infections that damage the tubes that can cause ectopic. Sometimes it's the sperm quality, motility issues and all that, it can cause problems. So it's not only superficial and obstruction that is the problem, it is also quality that's the problem. And ectopic pregnancies have been increasing because of sperm quality issues also. They have been increasing because of multiple treatments that women are taking. They are increasing because the incidence of infections have also increased, and high risk behavior is also increased. So they have 1 or 2 infections in their lifetime that can impact the tubal lumen. So all these things are there, but when there is an ectopic, you need professional help and you have to take treatment at that time, and you have to watch for another ectopic in future.
Got it.
So it's not as simple as it shows. It is seen that, there are patients who have had an ectopic 2 months back. They came with good pregnancy this month. Okay. It is possible.
Okay.
And I have seen a patient who had ectopic pregnancy in the right tube, another ectopic in the left tube, another ectopic in the right tube again because the tube was not removed.
Okay.
The tube was, they gave medical management. Because the left tube ruptured, they removed that. Right tube was there, again she got it in the right tube where she had the first ectopic. That also removed. She had ectopic in the cornua after that. Then another ectopic in this cornua when she had an IVF.
Oh my God.
So this is how peculiar ectopics are. So it also means that whenever you are kind of removing an ectopic pregnancy for rupture, please seal the cornua, because even if the cornua is open, you do an IVF, the embryo goes there and sticks. It doesn't know, it needs a place, that's it. And why it happens, nobody knows. So it's always important to make sure that whatever you do with your all senses. And I have seen the same patient, when both cornuas were nicely sealed, she had a cervical ectopic. So then we realized that the problem of her reluctant husband who was refusing treatment all this time, saying that it was her problem, was having higher DFIs and sperm infection, which he got treated, then an IVF done. I delivered her last year.